Okay, so it's three, two, one. We are live to the audience, sir. We can start the session. Over to you.
Okay. Good evening, friends. Today, we'll be discussing about the management the enlarged prostate. I'll be speaking both in English and Hindi, which is which can be easily understood by the common general public and some medical fraternity also. So, what is the prostate? Prostate is a gland basically situated below the bladder neck. It is a junction with the bladder and urethra. Its shape is just like a walnut shape. Normal weight is 20 to 25 gram. With the increasing ages, with the increasing age, the size of the prostate increases. So the symptoms of the prostate enlargement appears usually after the age of 45 to 50. It's very common after the 50. With increasing age, the symptoms usually appears. This enlargement of the prostate is basically due to some hormonal changes inside the body. Almost all male suffer from the symptoms of the prostatic enlargement. The symptoms basically can be divided into obstructive or uh, obstructive or irritative symptoms. Obstructive symptoms are also known as uh, unable or difficulty in passing the urine. Those of the earliest symptoms is hesitancy. Hesitancy is basically when a person goes to the toilet, immediately he cannot pass the urine. Urine immediately आना होता ही नहीं है. He has to wait for some time. Then the flow starts. Then the flow becomes sometimes narrow. The flow is not good. Initially, in young age, the flow and after the age of 50, 60, it becomes narrow. The patient has to, the person has to push or exert some pressure to increase the flow of the urine. Sometimes there may be intermittency. In intermittency, what happens? The patient urine starts, then it comes down or blocks, again starts, again stops, again starts, stops. Not intermittency. And what happens after passing the urine? There will be post-void dribbling. The urine passed, the patient passed some amount of urine. After that, few drops of urine keeps coming, and there may be sense of incomplete evacuation. After passing, the patient feels, "I'm not done. I have to pass some more amount of urine. I feel my bladder is still full or half full." So these are very common obstructive symptoms. Sometimes there may be retention of urine, acute retention or chronic retention. In acute retention, what happens? Suddenly, the patient is unable to pass the urine. There is pain in the lower abdomen. There is swelling in the lower abdomen, and every time he goes to the toilet, he may or may not pass. He may pass few drops or may not pass at all any urine. So this acute retention becomes a medical emergency. In chronic conditions, it's something different. In chronic conditions, what happens? The patient passes some amount of urine, but still the bladder is full and passes few drops of urine. The bladder is distended, and lower abdomen is full, and the patient doesn't sense any pain in that area because chronically there is some amount of retention. Sometimes there is also overflow in countries. The bladder is full and there is leakage of the urine through the urethra. Irritative symptoms are also very common because of the enlarged prostate. What happens with increase in the size of the prostate? Certain changes occurs inside the prostate, inside the urinary bladder. The muscle mass becomes develops. The urothelium, the inner lining of the bladder के अंदर जो layer होता है वो थोड़ा sensitive हो जाता है. So what happens is there is increase in the frequency. Normally, any normal person passes 6 to 7 times in daytime and 2 times in nighttime. Total 8 times is the average number of times he goes to the toilet. But when there is increase in frequency, it goes more than that times. Maybe every 1 hour, 2 hour. Sometimes it is so severe the person has to go to the toilet every 15 minutes, 10 minutes, 20 minutes, depending on the severity of the situation. It is not the increased frequency of micturition. There may be nocturia also. Nocturia is a nocturnal frequency. Night time, the patient goes to the toilet 3 times, 4 times, sometimes 5, 6 times, sometimes every 1 hour, where the sleep is disturbed. So there is sometimes also urgency. In urgency, what happens? Normally, a person can hold for some time his urination just till you finds until the person finds a suitable place and time to pass the urine. Maybe uh, you can hold for some time. But in urgency, what happens? The person is not able to hold the urination to a to find a suitable toilet or suitable time. So while traveling in car or bike or in train, he goes to the toilet very frequently. He maybe stop the car and go to the toilet, pass in the toilet. Sometimes urinary or incontinence also. There is a sense of feeling of the bladder. Patient wants to go to the toilet, but during going there may be some leakage of urination, and this leakage may be vary from minimal few drops to complete passage of the urine in the clothes. And these symptoms are gradually become very common, and usually it happens in almost all male after the age of 50. The severity depends upon the depends varies person to person. Sometimes there is a large prostate with less symptoms. Sometimes there is small prostate with more symptoms, because the size of the prostate, the amount of obstruction, and the symptoms, they are not directly proportional to each other. Okay. So when person is having these type of symptoms, he should go to the urologist, preferably MCS or DNB, and get some physical checkup. Physical checkup involves an examination of the lower abdomen, examination of the external genitalia, and the digital rectal examination. What happens in digital rectal examination? The doctor puts a finger inside the rectum and feel the size of the prostate. Apart from the size of the prostate, the other things he notices is there's a median sulcus, and whether it is smooth or firm or hard, whether it's a tenderness, if there is a nodularity and suspecting of any cancer. Certain investigations are also done. One is routine urine investigation, just to rule out these symptoms are not due to urinary infection. Sometimes the uroflowmetry test also is done to know the average flow rate, maximum flow rate, and an urinary system ultrasonography, kidney, ureter, bladder, prostate, and post-biotic residue. To know the size of the prostate, the amount of urine that remains inside after passing the urine, and the effect of the enlarged prostate in the upper tract, like kidney and ureter, whether the kidney is dilated, there is swelling in the kidney, swelling in the pipe, all those things. Certain changes also occurs inside the bladder, like there is thickening of the muscle, there may be diverticulum, there may be circulations in the bladder. These informations are easily obtained by the ultrasonography. Sometimes, because of enlarged prostate, the urine remains inside the bladder and may lead to formation of the stones. Usually, these stones are multiple and remain inside the bladder. Okay. So these are the four basic tests: one urine routine, uroflowmetry, ultrasonography. For the serum PSA, prostate specific antigen. PSA is just test done by taking a sample of blood, and that gives information about the possibility of CA prostate, because CA prostate is also very common with increase in age. After the age of 60, 65, the chances of CA prostate increases. In fact, CA prostate is the commonest cancer in male. So normal value of serum PS is up to 4, and more than 4, you suspect the cancer malignancy. So coming to the after the physical examination investigation, there are various modalities of treatment. Almost everybody given a chance of medical management. In medical management, do start some alpha blocker. In alpha blocker, uh, tamsulosin is given 0.4 or 0.42 mg at bedtime. In younger sexual active persons, alfuzosin is tried, which comes at 10 mg tablet. Now, recently we have, not exactly recently, it's almost 4 or 5 years, we are doing silodosin 8 mg and 4 mg. These alpha blockers are different type of different modalities of action. What happens? The prostate smooth muscles are relaxed in that alpha blockers, so that the amount of obstruction is physical obstruction, dynamic obstruction is less. Apart from that, silodosin has another characteristics. The muscles in the blood is also relaxed. So the nocturia part is better controlled with silodosin. Along with alpha blockers like silodosin, tamsulosin, alfegocin, we add finasteride or dutasteride. This finasteride, dutasteride, these are five HT inhibitors, dihydrogen inhibitors, so which convert testosterone to 5-dioxytestosterone, so that the size of the gland also decreases to some extent. If continuous use for 6 months, the chance of decreasing size by 10%. Decreasing the size also reduces the amount of obstruction. If the medical treatment fails, then we go for surgery. The irritative symptoms associated with the enlarged prostate also treated with anticholinergics like mirabegron, comes as 50 mg and 25 mg, sulfasenacin comes as 5 mg and 10 mg, darifenacin 7.5 mg or 15 mg, tolterodine 2 mg, 1 mg, 4 mg, depending on the strength and age. And these anticholinergics have some side effects like dryness of mouth, constipation, abdominal distension. All these things are uh, dry eyes also. But with mirabegron, the side effects are usually very less and is very well tolerated by the patient. Very commonly, patients of enlarged prostate with both obstructive and irritative symptoms, we advise combination of alpha blocker with anticholinergic. Now, very commonly using silodosin and mirabegron. Apart from these medicines, we sometimes also advise tadalafil, low dose tadalafil, uh, ARA inhibitor, 5 ARA inhibitor, which apart from controlling the prostate symptoms, improving the prostate symptoms, also increasing the sexual function of the patients. And usually with the enlarged prostate, sexual function also decreased, which becomes better with if you add this alpha blocker and anticholinergic along with this 5 alpha reductase inhibitor like tadalafil. When these medicines fail or the patient symptoms IPSS score, internal prostate symptom score, doesn't improve, then we go for surgery. Gold standard surgery is TURP, transurethral dissection of the prostate. Here, what happens endoscopically through the urinary passage, we cut the prostate into small bits and take out all those bits. Now we are doing holmium laser enucleation of the prostate and holmium fiber laser prostate vaporization and prostate enucleation. Both the surgery are 1 or 2 day maximum stay, absolutely or relatively bloodless. There is no bleeding. There is no cutting to externally also. There is no stitching also. But put the catheter, keep the catheter, Foley's catheter for drainage of the urine for 2 or 3 days. And with holmium laser and thulium laser, we need not stop the blood thinners the patients use, particularly the elderly persons with some cardiac element, the heart problem or coronary artery diseases. They use to take aspirin or other Pradexa or other blood thinner. They are not required to stop this, discontinue this with availability of the holmium laser. So these are surgeries very common and very widely available also. Almost every cities and sub-cities of the India, we are doing the surgery. Any major city, even district level surgery, district level hospitals are doing this kind of surgeries. So every person, any male person suffering from this kind of disease should consult a urologist and get it treated. If you don't treat it, it has got various complications like repeated infection and sometimes bleeding. There may be retention of urine, acute retention with pain. There may be chronic retention leading to swelling in the kidney, dilatation of the kidney with kidney failure. There may be formation of stones, all those things. So, I'll, by this, with this opportunity, I will thank to the Lupin Pharmaceuticals and I'll pass to my viewers that anybody suffering from prostate symptoms should consult a doctor, urologist, start the treatment, start with the medical treatment. If it doesn't respond, we'll go for surgical treatment.
Yeah, thank you very much, sir. So there is a
Thank you.
questions in a chat box one. May I help, sir?
Yeah. How to identify urgency due to BPH or OIB? Okay. When there is a urgency because of the OAB, only OAB, uh, there won't be any obstruction flow. There will only this your urgency associated to OAB. There will be frequency, there will be urgency, there will be urge incontinence and nocturia. Usually the flow is very good. And this urgency associated to OAB can happen to male or female also. But when there is urgency because of the BPH, ultimately this BPH affects the bladder. Then that makes the overactive bladder overactive and causing urgency. But in that case, the flow of the urine, sense of incomplete evacuation, or the intermittency caused by the dribbling, hesitancy, all the symptoms are may remain there. Mansu? Hello?
Yeah, sir. Thank you very much. So, can you wait for 1 minute more for the
Sure,
delegates if there's any more questions comes?
sure.
Yeah, thank you very much, sir. Yeah, so I got two questions in a chat box.
How to identify difference between BPH and prostate cancer? Okay. Between the BPH and prostate cancer, if you come to physical examination, I've just explained the digital rectal examination. Digit means finger, रेक्टम मीन्स दे जो लैट्रिन का रास्ता है तो उंगली डाल के सर्जन ग्लोव्स पहन के जेली लगा के उसको फील करते हैं नॉर्मली बीपीएच में व्हाट हैपेंस द प्रोस्टेट इज स्मूथ firm and there is no nodularity in prostate cancer there is the smooth the surface is irregular with nodules and very hard number one coming to blood test in BPH, the PSA level is normal between 0 to 4 nanogram per ml. But in prostate cancer, it is usually high. Higher the chance, higher the value of the serum PSA, higher the chance of prostate cancer. Third, someone there is a suspected in digital rectal examination or in increase in serum PSA, then go for a prostate biopsy, trust get a prostate biopsy, which delineates clearly says whether it is benign or prostate cancer. Doctor, sometimes it is confusion of symptoms of BPH and OAB. It's the same thing. When there is BPH, there is some obstructive symptoms along with the symptoms of OAB. OAB. When there is only OAB, so the obstructive symptoms are not there. Mansu,
Yeah, again there is a question, sir.
what is the prostate size which needs surgery? Actually, the size is not an indication for the surgery. It is the symptoms or the complications or the failure of the medical management which decide the surgery. When the person is symptomatic, whether some symptoms are there and the medical management fails, the patient doesn't get any improvement, then go for surgery. And second thing is the complications, like when there is a repeated infection, blood in urine, swelling in the kidney, derangement in the kidney function, or acute retention, recurrent retention, chronic retention, formation of the stones in the bladder, then one should go for surgery. There is another question: how to control leakage of urine after urination? The post, that means you are asking about the post void dribbling. It depends on the how significant. Start the medical management, and sometimes the few drops are coming. The patient is asked to wait for few seconds after completely passing the urine and use a blotting paper, any cloth for the few drops which they remain inside the urethra, just to milking it out and cleaning it.
Again, there is one question, sir.
What is the difference between bothersome and irritated symptom? Bothersome means the patient is bothered, whether it's irritated symptom or obstructive symptom. पेशाब रुक रुक के आता है या पेशाब बार बार जाता है, those are patient feels he is bothered, he is disturbed. Irritated symptoms are like frequency, बार बार जाना, urgency, जैसे महसूस होता है तुरंत जाना पड़ेगा, और नक्चुर या रात को बार बार उठना है, and leakage, that is urgency with leakage. The patient feels मुझे यूरिन अभी जाना है और जाते जाते कपड़े में हो जाता है, बाथरूम पहुंचने से पहले हो जाता है. That is irritated symptoms. Bothersome can be irritated. These are irritated symptoms or obstructive symptoms. Both can be others. Frequent night urination will start some, if there is a BPH associated, start with silodosin along with mirabegron.
Yeah, thank you very much, sir. So there are no other questions other than that. So
Okay,
with your
thank you,
permission,
Master.
shall we conclude?
Yeah, thank you,
Yeah,
thank you.
thank you.
Okay,
Thank you
Master.
very much, sir. On the behalf of organizer, I would like to thank you for your informative and educated talk on this night, sir. Thank you very much for your time.
Welcome, welcome.
Thank you very much, sir. Have a good night.
Good night.
Yeah. So from here, I'm ending this meeting. Thank you.